Hello, everyone. I'm Dr. Gayatri Veeramani Jayaraman. I completed my nephrology fellowship training at Harvard Medical School, and I'm a U.S. board-certified physician and nephrologist. I also served as assistant professor of medicine at Vail Cornell Medical College. Today, I'm here to talk a little bit about long COVID and some interesting nutraceutical approaches that we can consider. We know a lot of chronic diseases like diabetes, cardiovascular disease, cancer can cause fatigue. Taking care of COVID patients, we also know that fatigue is commonly seen in both the acute phase and recovery phase of COVID. There was actually this study that was published in JAMA that showed that fatigue was actually seen in almost 80% of hospitalized patients, COVID-19 hospitalized patients, and was also seen in close to 58% of patients in the post-COVID phase. Some predictors of long COVID syndrome, the constellation of sequelae that we see in the recovery phase, where the patient's not having any fever but continues to have fatigue and other symptoms, and is commonly called long COVID-19, and there's increasing interest in this. Intuitively, patients that develop long COVID are patients that are generally older, that have a longer and lengthier hospital stay, that are ventilated, that have underlying underlying health conditions like diabetes, hypertension, cardiovascular disease, etc. There was also this study that came out of India from PGI Chandigarh in 2021 that actually showed that brain fog was very commonly seen in COVID-19. Fatigue, myalgia is also commonly seen in long COVID-19. Also, as physicians, I know multiple other doctors that actually developed that had COVID-19 and then had long COVID-19 symptoms and continue to have symptoms of brain fog, fatigue, myalgia, etc. So what are some interesting molecules that we can consider to help with long COVID-19, fatigue, muscle cramps, and other such symptoms seen? One interesting molecule is PEA, which is palmitoyl ethanolamide. It is a PPAR alpha agonist. It's also a naturally occurring substance. It's actually found in foods like peanuts, egg yolk, soybean, etc. Palmitoyl ethanolamide is also a very powerful anti-inflammatory and analgesic, has a very powerful analgesic and anti-inflammatory effects, and can possibly downregulate various inflammatory mediators, and hence has a role in long COVID-19. Interestingly, PEA has also been around for over 50 years. It was developed by Dr. Vita Levi-Montalcini, and even though been around for over 50 years, since 1990, there's been increasing interest in PEA as a nutritional supplement, and there have been more than 100 clinical trials with over 10,000 patients, and no significant adverse adverse side effects or drug-drug interactions have been reported. There's also a study that in the US that's ongoing, scheduled to complete in December 2021, where they're studying PEA in hospitalized COVID-19 patients, and this study has enrolled about 350 participants. So PEA has a very interesting profile, has a very safe, has excellent safety profile, and can be considered in treating long COVID-19 and beyond, in neuropathic pain, chronic pain, etc. Another interesting molecule is acetyl L-carnitine. We all know of carnitine, and we've heard of the carnitine shuttle and how carnitine helps transport fatty acids to the mitochondria in the generation of ATP. And acetyl L-carnitine is better than L-carnitine because the acetylation makes L-carnitine more readily absorbed by the gut. Also, acetyl L-carnitine crosses the blood-brain barrier more readily than carnitine, and hence can help with brain fog that is commonly seen in COVID patients. Interestingly, acetyl L-carnitine is also precursor of acetylcholine, and acetylcholine is increasingly studied in age-onset dementia and memory problems, and hence acetyl L-carnitine has a very interesting role in post-COVID-19, long COVID-19 syndrome, and in patients experiencing brain fog, memory problems, confusion, inability to concentrate, etc., commonly called brain fog. Another molecule that's been around for a while is vitamin E. We all know of vitamin E's antioxidant and anti-inflammatory properties. There have also been more studies on its use in helping with muscle cramps. There was a study that showed that it can help with muscle cramps, which is actually commonly seen in dialysis patients. And there are other studies that show that vitamin E can help with muscle cramps in non-kidney patients as well. And because of its anti-inflammatory and immune boosting properties, and help with muscle cramps is also an interesting addition in treating long COVID-19. Thank you for your time.